Good evening. Thank you all for tuning in this afternoon. I suspect I may have had the pleasure of meeting some of you earlier today during New Futures' open space event, but for those of you I have not met, my name is Gary Lavoie, New Futures Board Chair. Let me start by expressing my sincere congratulations to all of tonight's honorees, and a special thank you to the New Futures staff for their hard work in putting together this event, as well as the event earlier today. We tried something different this year. I know it was stressful for them, but the end result was fantastic. Speaking of the event earlier today, I need to say, despite my involvement with New Futures the last 4 years, I never ceased to be amazed by the dedication, passion, and fearlessness of the individuals and advocates that we work with. Those that joined the event earlier today engaged with us in a new process, opening space to discuss some tough issues impacting civic engagement in this state. I want to thank you for helping us all to better understand where New Futures can and should be working to help address these issues, as well as for your willingness to stand with us as we navigate solutions. Your participation today was tremendously helpful and valuable. Stay tuned for what comes next. I know I'm excited to keep that momentum going on priorities discussed during my own breakout session, and I'm sure I'm not alone. This time last year, I think many of us expected we might be able to reconvene for our usual in-person annual event. As we all know, the pandemic had different plans and continued to test each of us in different ways over the past year. As I learned a bit about tonight's honorees, I was struck by their stories of resilience and determination to make things better for our kids, our communities, and all Granite Staters during an unprecedented and challenging time. These individuals that you're about to be introduced to are nothing short of amazing. They are role models in advocacy, which we all know remains as important now as ever. As you watch and hear a bit more about each of these honorees and their work, the goal is that it inspires a bit of hope. Change and progress are possible when we share our stories and work together on common goals. This is what New Futures is all about, and what these individuals help to drive home, at least for me. Now, before turning this over to Michelle for the next leg of our program, there are two individuals I would like to take a moment to recognize. Kelsey Hale, New Futures' immediate past chair, and the Honorable Tina Nadeau, New Futures' secretary. Both Kelsey and Judge Nadeau will be terming off the board in a few short months. I speak for the entire board when I say you are leaving impossibly large shoes to fill. I would like to take a moment to express our collective gratitude for your many hard years of dedication and service to New Futures. While we are likely to keep our hooks in you on various committees, your leadership will be missed on the board. On behalf of all of us, your fellow board members and staff of New Futures, thank you. And now I'm happy to turn this over to Michelle Merritt, President and CEO of New Futures, and hope you all enjoy the rest of this virtual event.
Thank you, Gary, and thank you to all who joined us earlier today for our open space event, and those who are joining us for the first time for our 24th annual recognition event. Over the next hour or so, you're going to have the opportunity to hear directly from some of our incredible partners and advocates as we recognize and appreciate their work during the past legislative session. At New Futures, we have a deep understanding that working towards policy change is truly a team effort. And there is no doubt that this past year continued to test the resiliency of New Hampshire's children, families, and communities. And the value of citizen voice to articulate what individuals need to weather the present storm could not have been any more apparent this past year. Advocates rose to the challenge. They embraced new methods for legislator outreach, education, and engagement, whether that be hosting virtual roundtables, Zoom coffee meetings, teletown hall forums, or social media live events. They made hundreds of phone calls, wrote dozens of letters to the editor, and openly shared their personal stories through remote legislative hearings. And while these coordinated advocacy efforts certainly and without a doubt led to some legislative wins, they do fall against the backdrop of unprecedented political divide, misinformation, and enhanced inequity. And for the advocacy community, what that means is that our work must continue, and it must continue in a more challenging environment than what we have encountered before. But we share a responsibility to continue to do the work and to continue to ensure that those that have been historically marginalized and excluded from the policy-making process are actively listened to, are truly heard, and are supported in the months and years to come. For New Futures, that means taking a hard look at how we offer opportunities for engagement. That was part of the event that we held earlier today, as well as how we support barrier removal to allow for individuals to engage in our policy tables and coalitions, and also make sure that we are independently supporting those individuals and organizations that are elevating the voices of underrepresented Granite Staters. New Futures remains committed to using our own position to help advance this work, offering field grants and barrier reduction assistance to bring in new and diverse voices into New Hampshire's policy conversations. And in 2022, we are dedicated to expanding this type of support into each and every issue area in which we work. For more information on these opportunities or to receive alerts on future opportunities as they become available, please visit our newly refreshed website, new-futures.org, and sign up for our email updates. As we look ahead to 2022, there are a few things that are already clear. Opportunities for advocacy, particularly administrative advocacy and collaborative work with state agencies, will be robust. Between the state budget funding allocations, associated policy changes, as well as federal relief dollars that are flowing to the state that need to be dispersed, monitoring all of the associated contracts with these funding allocations and following those dollars out the door and into our communities is going to be essential. All along the way, there are going to be opportunities for advocacy, education, and engagement, though it's going to look different. Instead of testifying on a public hearing for a bill, you may hear about important public input opportunities on state plans or administrative rules. For those who have not previously engaged in this type of work, it's important that you know that we are here to help, but this is also an important part of the policy and administrative process. That passing a bill is just the first step. Some of the hardest work that comes is implementation of policy, and that is administrative advocacy. Our continued progress against the addiction epidemic, the mental health crisis, the sustainability of future early learning programs, our public health infrastructure, and full implementation of the system of care for children's behavioral health all require this type of work. So consider this to be your official invitation to join us. Please be on the lookout for future training opportunities related to administrative advocacy. And when you see a call to action from us, read it. Ask questions if you're not sure exactly what something is, and be willing to act and volunteer your time. And as always, as I mentioned earlier, if you need support, please know we are here to help and empower you. Civic engagement is an unparalleled tool for change, but it does require us to seize the opportunities that are available to us. And we are all stronger and more successful when we advocate together and we support shared and common interests, encouraging the individuals that we work with to share their stories of lived experience. Our 2022-21 award winners offer some stellar examples of collaborative advocacy and the impact of individual storytelling. The individuals that you're about to meet embody New Futures' mission and have individually taken action to improve the lives of the people in this state. Biographies for each of our award recipients can be found on the New Futures website as well as on our social media. Now, the first award I actually have the pleasure of introducing myself is the New Futures President's Award. This particular award has not been given since 2017 and is reserved for individuals and organizations who have gone above and beyond to help protect the health and wellness of Granite Staters. And I can think of no two individuals or an entity more deserving of this recognition than Dr. Ben Chan and Tricia Tilley and the New Hampshire Division of Public Health Services. Over the past year and a half, under their leadership, New Hampshire executed a coordinated response to the COVID-19 pandemic and also coordinated a comprehensive vaccination effort. I had the honor of sitting down with Dr. Chan and Tricia to discuss their experiences, their lessons learned, and hopes for the future of public health, and I'm happy to share a bit of that conversation with you today. Hello, we have Dr. Ben Chan and Director Tricia Tilley from the Department of Health and Human Services Division of Public Health Services with us. And I am pleased to be able to present the two of you as well as the department with this year's President's Award. Just for a little background for those that are joining who haven't witnessed New Futures give a President's Award before, this award is reserved for individuals or entities that have worked over the last year, and in this case, really a year and a half, to push forward New Futures' mission to improve the health and wellness of Granite Staters. Clearly, we do all of our work through a public health lens, and in the time of COVID-19, grappling with a global pandemic, there are no two individuals or division within the department that has taken on the mantle of this more and embodied that mission. So I am pleased to be able to present you this award this morning, and also to be able to have this conversation around the importance and value of public health, take a peek into some of the work that you're doing within the department. So I thought we'd kick off our conversation and discussion with just a little bit of background and where we were, and then sort of where we are and where we're going. Nationally, there's been a real varied response to the pandemic, and we've seen different levels of success in mitigating community spread. And I know from working in public health prior to the pandemic, we witnessed the department prepare pandemic and emergency response plans as parts of your regular work. Would you be able to describe a little bit about the role that that played in New Hampshire's pandemic response, and any lessons learned that you may have as a result of going through this experience? Because I'm sure when you do emergency response plans, you do them with the best of intentions and making sure that you are adequately prepared, but fingers crossed that you never actually have to use them. And you ended up having to use it. So I'm curious if you can talk a little bit about that experience.
Sure. I'll go ahead first, and then I'll let Dr. Chan correct me where I may have gone astray. But, preventing a pandemic may never have been possible. We probably could not have prevented the pandemic. So being prepared is the key, as you noted. But I think what we learned that in the past, we have may focus too much on plans that sit in 3-ring binders on shelves, and we paid less attention to the actual operational readiness of our state and our local health agencies. Pandemic preparedness is more than just data aggregation or rapid vaccine development and distribution. We have to ask ourselves, when this emergency arrived, did we act fast enough? Did we have the right workforce? Did we have effective data collection and technology? And previously, preparedness had really been the work of a few highly competent, specialized individuals and programs, but we really hadn't prepared all of us in the community. And we certainly hadn't had the conversation about how to not only be prepared to take care of your own individual health, but how to take responsibility for the care of a community or groups of people. If you think back to the early days of the pandemic, we can recall that our testing efforts right in the very beginning were thwarted because we didn't have access to basic supplies. Things like the fancy Q-tip that needed to swab your nose, or even gloves for healthcare workers. And I don't think any of us can forget the hand sanitizer shortage. And while we've learned so much about things like supply chains, and we've learned how to leverage partnerships with business partners, but before March 2020, those partners had never really considered themselves as part of the public health response or public health preparedness. On another note, we found in this pandemic that part of public health preparedness is ensuring that we have the healthiest and most resilient population possible. Especially before we had widely available vaccine, we saw those disparities very clearly among groups of people that had disproportionate burden of chronic disease or who were in jobs that put them on the front lines. These folks had the worst outcomes. We also learned things that, like self-care, is not self-indulgent. Our public health workers' prevalence of PTSD was 10 to 20% higher than for frontline health workers in the general public. Our contact tracers were taking the brunt of angry and sometimes scared individuals. Almost a quarter of public health workers across the country felt threatened or bullied. Felt threatened because they were trying to help, trying to mitigate risk, and trying to protect the health and safety of all of us. And I don't know if we could have been prepared for that. More importantly, I think we've learned humility with regard to this virus. And when you match that with the resilience of the families and communities, I know that we have the capacity to meet any challenge in front of us. And that's really what's been inspiring and motivating us as we think again, both in looking backwards and looking forward, about what it takes to be prepared. I don't know if Dr. Chan has other things he wants to add to that.
Yeah, first let me also say thank you to New Futures for the honor of this award, really on behalf of our team. And it's been a large team responding to this COVID-19 pandemic. And I think that highlights one of the key aspects of public health is that it really takes all of us, not only within the public health agency itself, but all of us in the community and partnerships to really enact a lot of the goals of public health. I find myself more and more saying and acknowledging that public health is a team sport. And New Hampshire has a centralized public health structure, meaning we don't have a large number of town or city or county level health departments like many other states do. Certainly we have the cities of Manchester and Nashua departments of health, which have been great partners in this pandemic response. But otherwise, we need to find ways to build partnerships with state and community organizations to enact the work of public health. And I think that's one of the key aspects that's really come to light during this pandemic. Sort of getting back to your original question, we have been planning and preparing for the possibility of a pandemic for years. There's been federal funding to do this. There's been groups of individuals that have been working to develop, pandemic preparedness plans to try and build these partnerships, within communities. But a lot of this planning has been focused on the possibility of a flu pandemic or an influenza virus pandemic. And as we've seen, COVID-19 is very different, is a very different virus from the influenza virus. What we've also seen is that we've needed to build and expand more of those partnerships to respond to this pandemic than I think initially we had worked at and planned on doing, and that has been one of the main struggles, but also one of the main highlights I think of our response to this pandemic and what we've learned. I think you've seen public health over the last year and a half expand many of the partnerships to do testing in communities, to roll out vaccination, to reinforce the messaging and importance of prevention strategies or mitigation measures to control this pandemic. And I think some examples of those, the National Guard, right? We have not historically worked very closely with the National Guard, but they have played such an integral role in responding to this pandemic and setting up testing centers and vaccination clinics that without their support, a lot of the work in the beginning and middle and later aspects of this pandemic wouldn't have been possible. We've ramped up our work with our regional public health networks who have been in the past and remain critical partners in this. But you've also seen us expand a lot of our work to schools. We're engaging with schools, both K through 12 schools and also colleges and universities much more extensively than I think we ever planned to in the past. We're working and have worked more closely with the Business and Industry Association of New Hampshire. We've engaged with long-term care facilities. We've had much more work aimed at public health messaging. And I think all of these are aspects of us trying to expand the work of public health, bring in new partnerships to have implementation and of these necessary pandemic control measures, whether it's testing or vaccination or messaging around many of the other prevention strategies. And so I think a lot of this really goes back to teamwork and building partnerships. And that's something that I think you've seen expand exponentially during this pandemic, which is one of the great, I think, learning lessons of how to do this in New Hampshire.
Mm-hmm. That's a great segue for Tricia, and talking a little bit about, obviously there was a lot that was happening behind the scenes that we saw Dr. Chan on TV, and I think the public heard a lot about what the state was doing, but to actually operationalize those plans is a tremendous undertaking. I'm curious if you can talk a little bit about what was happening behind the scenes within the department. You've been in department leadership for years and assumed leadership roles during the pandemic. What was that like for staff at the department? And then how did that also change any sort of dynamics internally, having to shift from day-to-day work to crisis response?
Oh, that's a great question. Thank you. So first of all, I'm going to echo everything that Dr. Chan just said. I mean, public health as a team sport has really been our motto, and we could not have gotten through this pandemic. We're not through it yet, but we certainly couldn't have gotten this far without all of these partners sitting at the table. And, you know, I think about matching the expertise that we have within public health, whether that's expertise in our public health lab or the infectious disease knowledge or the communication skills even of Dr. Chan, or the incredible help that we receive from the National Guard or partners at Homeland Security. You know, we picked some of the smartest minds we could find to help us direct this response and manage this response. And that competence and integrity and all of that straightforward communication that we tried to create, what our goal was to build some trust. And across the department, you know, not only Division of Public Health, but across the Department of Health and Human Services, we repurposed staff. We had DCYF nurses from the Sununu Center working in disease investigation and contracting. We brought folks in to make little packets that we gave out at food insecurity events where we were giving out stuff. We were putting in oral health activities and toothbrushes and toothpaste, and we had worked with the Dental Association to put that together, standing with folks with our lab, folks from the National Guard, all packing, you know, these little packages. Meanwhile, we were also working closely with all our partners to address things like food insecurity, things like early childhood and parenting supports in this time of isolation. We were working on behavioral health. We were working on housing together. I mean, I think COVID proved once and again that housing is healthcare. You know, we used our data skills to assess DCYF in developing some prevention programs, and also as they were starting to look through their data around where kids were most at risk at this time when kids were not in school in those early days. And we know that there were things going on, and teachers and schools had not had good connection with families. So we worked in partnership along the way. You know, we worked hand in hand with childcare, as Dr. Chan noted. You know, it's amazing that New Hampshire childcare never closed, and that's in part due to Dr. Chan and our team's willingness to make themselves available to individual childcare providers to answer their questions. And so all of this took, you know, a lot of orchestration of a lot of people, you know, one of the things I always remind people, we had to empty out of our office right away, because while everyone else went home in the early days of isolation and early days of that pandemic, we actually were bringing people on site to do this work. So we had to get out and move into different places. You know, we've had whole new locations that we've had to build just so that we could have the appropriate social distance and that we could have room to mobilize all these incredible partners. I think we were successful because of the relationships that we had foundations on. You know, the work that public health has done with childcare in the past, where we know each other, and we were able to build on that relationship to be able to support each other through this time. You know, folks were helping us. You know, again, we were pulling in staff from all over the department, across state agencies, to come help us with the response. And in turn, we were helping all of our different partner programs manage what the response looked like for them, what it looked like in an individual childcare center, what it meant for rules. And so, you know, it's mind-boggling to think about the way that we could flex all of those folks together and maintain the work, all of our work at the same time. Not only were we fighting COVID, but we were still doing all of the other sort of invisible glue that public health and human services put together that, you know, when it's working well, you never see us. So it was an incredible operation.
Yeah, and just to echo what Tricia said, it's not just about building the external community partners. It's about developing those internal partnerships as well. And all of the work of this pandemic hasn't just fallen to public health or the Department of Health and Human Services. We've been reaching out and working at all levels of government with other departments, Department of Homeland Security, for example, Department of Education, and many others. And I think one of the key principles of emergency preparedness and pandemic response is really to do so in a coordinated fashion, to respond in a coordinated fashion. So we have some very skilled individuals who oftentimes are working behind the scenes, managing the hundreds of people, coordinating the, incident management teams and the different aspects of pandemic response. Even down to logistics of, as Tricia mentioned, finding new space and finding new computers for everybody and bringing new workforce on, and coordinating the different aspects of the response, whether it's the group working on vaccination, working with a group, working on testing, working with our vaccine allocation strategy branch. There have been so many pieces of this response that it really takes good skills at managing and coordinating. And I think we're very lucky to have many of those skilled individuals working behind the scenes. And so, well, maybe it's a few people up front in front of the media and the public eye doing a lot of the public messaging. I just want to give a big shout out and thank you to all of the dozens, hundreds of people that have worked behind the scenes on this response, who are on literally the front lines of the public health response, making the response happen, doing the work, doing the contact tracing, doing the testing, doing the vaccination. It's been nonstop for a good at least a year and a half, and it's going to continue into the near future at least.
So you touched on some, I guess the best way to refer to them as silver linings is that we have sort of realized that there are some ways in which we were working pre-pandemic that we can change going forward, and it would be to the benefit of the people of the state if we found those efficiencies and built those relationships. One of the things that New Futures has found is that obviously public health cuts across every single policy area in which we work. Tricia, you had mentioned behavioral health, children's behavioral health, early childhood, harm reduction, substance use. The whole gamut is touched by public health in some way. And I think prior to the pandemic, the concept of public health in and of itself was difficult for people to understand, like what public health was, why it was important, why we were talking about public health. And it wasn't until there was this real tangible thing that was impacting them in their day-to-day lives and saw what the pandemic response is, and that this is one component of public health, that the understanding seems to have shifted within communities. So I'm curious about what your perspective is on that, if you've seen something similar, and are there opportunities that this brings of this enhanced understanding of what public health is and its value going forward for the field?
I still think it's a hard concept to get your head around.
Yeah, it definitely is, but I think it's getting better.
I think if you'd asked me before the pandemic, I would say, we're always striving to make sure that public health is out there, ensuring that there's clean water to drink and safe or more nutritious food to eat, and access to a broad range of services that promote health and wellness, from vaccines to early access to integrated behavioral health services to livable and walkable communities. I mean, it's so broad. Yeah. And as I mentioned before, when we are at our best and when the community is at its strongest and most resilient, you don't even know we're there. Public health is invisible. It is that glue that holds things together so that we can really attain whether it is our optimal health or other sort of ability to focus on the rest of our lives. One of the good things about the pandemic is it has brought some increased resources to our public health infrastructure, whether it's funds to shore up our data systems, or funds for healthcare worker recruitment and retention, or support to get community health workers into every community across the state. So for me, this is our legacy. This is the moment that I think many of us have been waiting for, where we have some additional tools in our tool belt and additional resources to go out there and continue to address that foundation. As I mentioned before, even part of preparedness, one of the things I don't think we had always thought about was the strength of the community and how making sure that our communities are resilient. And so with some of these new resources, we really have the opportunity to think about things like health equity and eliminating health disparities out into the community. And I think that's something that lots of people get super jazzed about, super excited about, because they can understand that part. As we look at the data, I mean, all of us in public health are a little data wonky, and we love our, our little graphs, and we love our confidence intervals. But the ability we have right now to translate that into what that looks like in communities and the ways that we can close those gaps and eliminate those disparities is incredibly exciting. So if there's any silver lining for me, it's just that little bit of one of having now the resources and the support from lots of folks and quite frankly, a whole new workforce that knows what public health is, or at least has seen Dr. Chan on WMUR every day, and are going to bring their skills and talent to help us move to the next phase.
Yeah, I again agree with Tricia. I think public health continues to be a excuse me, a difficult concept for people to grasp and understand, and I think there's reasons for that. One of the ways that I tend to think about and talk about public health is that public health is the work that we do collectively, not just the public health agency, but those partnerships, everybody in the community that we've been talking about. It's the work that we do to impact health in a population or population health. Mm-hmm. And I think there's a couple aspects of this. One is, is who's the we? Again, the we is all of us. It's not just the public health agency. It's not just the nonprofit community organizations. It's not just the healthcare providers. It's businesses and other organizations and individuals within community. And so we really look at public health as a collective responsibility, and hopefully people have heard that message over and over throughout the course of this pandemic. But I also think that means that there's a lot of opportunities for people to be involved in the work of public health, meaning there's not just one route into public health work. You don't have to go to a school of public health or get a master's of public health degree or have a doctorate in public health in order to do the work of public health or even work at a public health agency. There's multiple different routes of education, multiple different routes of experience. And I think people need to be aware of those opportunities within their community, because it doesn't require driving to the state health agency every day to do the work of public health. I think the other aspect of this, I think, is exactly what Tricia was talking about, is that how do we impact the health of a population? How do we define population health? And I think that the pandemic certainly has shined a light on the infectious disease aspects of population health. But we're going to see the impacts of this pandemic for years and decades to come. And it's not going to be an impact on infectious disease health necessarily. It's going to be impact on all the other health factors that we still have to address. Mental health, chronic diseases, right? I mean, people are having delays in treatment for other health conditions, whether it's heart disease or cancer, because of this pandemic. People are having mental health strains and mental health issues because of the duration that this pandemic has gone on. So, we have to look at health in a holistic sense. Not just necessarily the absence of disease, but the ability for people to address the other health issues, health concerns they may have, and enable people in their communities to be well, to be healthy. And again, going back to the public health aspect of this, it takes all of us to do that.
Absolutely. And, I just want to underscore the thing that we have seen the shift is people understanding that it's not just about their individual health. It really is about being concerned about your neighbors and your communities, and understanding that community health actually does impact your individual health, and it goes back and forth, and what that relationship is. That's a hard thing for folks to sometimes think about, especially in the middle of a pandemic. But it's really how we're going to make progress moving forward. And again, I can't underscore enough that it takes all of us to do that.
Well, I wish that we had more time, because I think that we could probably talk forever, but I want to thank you both for your continued and tireless work. I'm sure that at times it feels thankless, but if I can be the one person to tell you today, thank you, and also that you are in your work every day actively saving lives of Granite Staters and improving the health and wellness of the people that live here. I'm so grateful to have both of you as leadership in this state. And again, we are just honored to be able to present you with this award. So thank you both. And I know that we'll see you around the State House or in other advocacy efforts that we have coming up in the upcoming year. So thank you, and we'll connect soon.
Yeah, thank you. It really has been a privilege to have this recognition, and more importantly, it's a privilege to do this work with all of the partners and all of the advocates out in the community. We can't do it alone. I think that's the one theme that you've heard from both Dr. Chan and I. We can't do it alone. It takes all of us. So thank you. Conversation's been fun.
Yeah.
Thank you, Michelle, and thank you to New Futures. And I just want to echo again, thank you to our entire team that's worked trying to control this pandemic, and we're honored to be able to accept the award and have this conversation. So thank you again.
Congratulations again to Dr. Chan, Tricia, as well as everyone who is working within the Division of Public Health Services. And thank you for your continued and tireless work to combat the COVID-19 pandemic. New Hampshire is healthier and safer because of your leadership. Our next award is the Legislator of the Year Award, and this year is being presented by New Futures Vice President of Policy, Jake Berry.
Good afternoon. My name is Jake Berry. I'm the Vice President of Policy here at New Futures, and I have the distinct pleasure of presenting this year's Legislator of the Year Award to our dear friend and dedicated champion, Senator Tom Sherman. Each year, we give this award to a lawmaker who demonstrates a deep understanding of and commitment to New Future's key issues and works with us to advance our goal of ensuring the health and well-being of all New Hampshire residents. This year, no one is more deserving of this award than Senator Sherman. Now in his second term in the state Senate, Senator Sherman, who is retiring after 30 years as a physician, has emerged as one of the state's greatest public health champions. Senator, please tell me, how do you balance being a physician with your work as a state senator? And do you have any advice for physicians looking to jump into policy and advocacy work?
Well, thank you, Jake, and I'm deeply honored and humbled by this award. In terms of I've always said that being a physician and then going into public advocacy is just an extension of our training. I've also said that my entire career as a physician, what I've found is the winning combination and best for my patients is always holding their priorities and what is most important for them as my highest goal. So I won't go wrong if everything is about my patients. Same thing's true as a legislator or as an advocate, and that's not just my patients, but the constituents are the ones that are most important to me. What's good for them? What do they need? What are they looking for? And making sure that's always my top priority. That similarity between being a physician and being an advocate for people is really what makes legislating feel kind of natural for someone who's been in service as a physician. So for other doctors and nurses and anyone in the healthcare profession, I think they will find that coming into either a role of public advocacy or actually being an elected legislator or an elected official is really a natural segue. So I've joked and I've said that my practice of medicine is my micro practice, and my work in the legislature, either as a state rep or as a state senator, has been my macro practice. But the principles are the same. And the principles are that in my micro practice, it's the patient. In my macro practice, it's the constituent.
Great. Senator, thank you so much. Last year, Senator, you really led the charge on dozens of bills looking to increase or expand access to health care, including mental health treatment and substance misuse treatment for children and families and others in need. How does your experience with your patients inform these specific priorities or the work that you're doing?
When the door closes and I'm in the room one-on-one with my patients, it is a unique window into the real lives of people. There's a trust that we've developed over the course of our relationship. And often, because they know I'm a state senator, they'll talk about what has been most important to them. and in a way that, there's no barriers. I can bring that in an anonymous, way. I can bring what they've taught me, that perspective, to the legislation. And some have been very specific, like back when I was a state rep, being able to be a part of bringing Medicaid expansion to New Hampshire. Not only did I see the problem before Medicaid expansion, but I was able to see the benefit after Medicaid expansion, the direct benefit for my patients, both in their health and also in their economic well-being. So that combination of having that window, that perspective, is probably the thing I'm going to miss the most, but I won't forget. I have that 30 years of experience of having that window and that perspective to know how to really reach out to people and listen and be a part of their lives, and then translate that into successful legislation.
What incredible insights. Thank you, Senator. Last year specifically, we really appreciated your work on bills to expand insurance coverage for children experiencing a mental health crisis, and to increase care coordination, for behavioral health treatment out of primary care settings. Are there particular bills that you've worked on that you are most proud of, and what would you anticipate as sort of areas of focus in the coming legislative session?
Well, in terms of bills that I'm most proud of, the efforts I'm most proud of is really keeping the pressure on to be sure we are fully and adequately and in a robust fashion addressing the problem of children in mental health crisis. That's probably my highest priority. And of course, we're not there yet. We had a Supreme Court order because the legislature was not acting, and the administrative part, the executive branch of our New Hampshire government, was not acting in a robust way. In 2019, we provided the framework and the funding to actually address this with systems of care, as you know. Unfortunately, that was never implemented fully. It's now being implemented, and we were able to capture some of that funding that was left over from the 2019 budget that we provided by not allowing it to go away or lapse. And then we also have more money in the budget for this to be sure we fully address it. But we're not done. We have to make sure that we stay on top of it, that it is fully implemented, because it should be a priority, because our children are our future, right? The other piece of legislation that I think is really just a milestone piece, and I can't take credit for it. I was prime sponsor, but the people bringing it forward was all the work on advanced directives. In the past session, through a very difficult legislature, we were able to pass probably the most fundamental, updating, simplifying, making more user-friendly process of advanced directives and determining end of life. And we did it in a way that was hugely inclusive. People were concerned about all sorts of issues. Well, we had the diocese there, we had all of the people at the table who had both expertise and deep concerns about what was going on. And we came through with a bill that is now law that will make the process much easier for patients, much easier for the people supporting patients in those very, very important decisions.
That's great. Well, thank you for that work, Senator. And looking ahead, what do you think we can expect from the session to come?
I have to say I'm deeply concerned about the direction of this legislature. Fundamental scientific and medical understanding is being subverted. We know that there are two things in public health that have had the biggest impact in the history of man on our public health and wellness. One is public sanitation, believe it or not. Drinking water, septic, sewer, that is probably the most important in terms of stopping the spread of disease. Two is vaccines. New Hampshire has had a strong effort over the last decade, and I've been a part of it since 2012, to make sure that we are up to date and ready to go with our public health network, our public health response, our ability to provide vaccines, our ability to track the provision of vaccines, and that includes a registry. Believe it or not, New Hampshire was the last state in the nation to enact a vaccine registry. I've literally been working on that since 2012, and it's literally taken that long. All of that work is at risk because of this legislature and because of the people who are leading this legislature. And we have to be sure over the next year that we don't allow them to dismantle the very system that allowed us to survive COVID as well as we did. This was a system response. It was Dr. Chan, it was Trish Tilley, it was Lisa Morris, it was the commissioner, it was the governor. But it was a system that was already in place. And this legislature is in the process of dismantling it through bills that the governor has actually signed. And we have to be sure that that stops, that we don't go any further to dismantle the system that has allowed us to get through COVID with as little loss of life, as little illness as possible. And by the way, part of that is going to be really retooling our effort to get the rest of New Hampshire vaccinated. All people who are eligible for vaccines against COVID should be vaccinated. We know it works.
That's right. Well, Senator, we want to thank you so much for this critical work. Thank you for being here with us today, and thank you for being such a wonderful champion for the health and wellness of New Hampshire.
I have to say thank you to New Futures, not for the award, but for the incredible partnership and support. One of the areas where, as you know, we worked very closely with New Futures was on prescription drug pricing and prescription drugs. We have launched the Prescription Drug Affordability Board. I'm on that, and my partner Holly is there with me every meeting. So thank you to New Futures for being such wonderful partners as we work towards the health and wellness of the state.
Perfect. Well, Senator, thank you again.
Thank you.
Congratulations, Senator Sherman. It has been a privilege for all of us who have had the opportunity to work beside you over the past year and a half on behalf of all Granite Staters. You truly do lead by example and are an inspiration, or at least should be an inspiration, for all physicians across the state on what advocacy can look like for your patients, and that does extend beyond the exam room. I personally look forward to our continued work and collaboration in the area of children's behavioral health, and am confident in the bipartisan leadership on that particular issue in the Senate will allow us to see some real progress on the issue of ER boarding in the coming year. Our next award is our Advocacy in Action Award, which is being presented by Kate Fry, New Futures Vice President of Advocacy.
Hello, my name is Kate Fry. I am the Vice President of Advocacy at New Futures. I'm honored today to introduce you all to Kimberly Wade. Kimberly is our Jennifer Ware-Will Norton Advocacy in Action Award winner. Congratulations, Kimberly.
Thank you. It's an honor.
Kimberly is amazing. She was promoted to her current position as Director of Prevention Strategies at the Partnership for Public Health this year, and she has been doing such a great job. Her dedication to the work is inspiring. She's advocated across all of our policy areas this session, both in her capacity as a prevention professional and in her personal life. She wrote emails, made calls, submitted LTEs on all of our priority issues, and even more. If the issue isn't in her field, she advocates as a private citizen when she gets home from work. She just goes above and beyond making changes in New Hampshire. How much Kimberly cares about the health and wellness of everyone in New Hampshire is clear to see, and we can always count on her to come to all of our events, pass on all of the information, and answer the surveys we send out. So we want to thank you, Kimberly. This award recognizes the grassroots advocacy efforts of an individual, group, either at the state or local level, and you are certainly a great example of this work. So I just want to ask you a couple questions about why you've become such a rock star in advocacy. I do want to mention that this award is in honor of Jennifer Ware-Will Norton, who used to be the policy director here at New Futures, and also the backbone behind the Children's Behavioral Health Network. She was just exemplary as far as advocacy work, and it's just so great that you are getting this award in her name. Jennifer passed away in 2016, and she leaves behind her husband Steve and her children Greta and Anders. And every year they're just so honored that somebody gets this great award in her name. So one of the things I wanted to ask you is, what do you consider one of your biggest policy or advocacy wins?
In my opinion, one of the biggest ones we did was making tobacco 21. And it really showed how in the state of New Hampshire you can get a bunch of citizens, both private and professional, to talk about the importance of prevention and move the needle and really make it that much harder for children to use substances in our state. And that went from everybody writing letters and showing up at the Zoom meetings at the State House to really point out the science and the facts about how changing that age would probably change the trajectory for a lot of our youth in this state. So
that's so true. And I think you mentioned earlier you felt like that movement was like a groundswell of prevention activity. And you know, I think you're right. You just, you know, so many people had worked so hard on this issue, but
Yes.
it's people like you in the field talking to legislators that really pushes the needle just a little bit further.
Well, and I think you guys made that great storybook, and it really shows how throughout the state, both private citizens and people that do prevention work, organizations, groups banded together. We had coalition leaders. You know, you're getting all these people from different parts of our society and sectors and community, really showing that they supported this protective factor for our youth.
Absolutely. It's great. So, from your perspective, why is policy and advocacy work so important, and especially within health and wellness?
I think it's important because we need to advocate for those that either don't know how to advocate for themselves or are unable to advocate for themselves. And that's why a lot of times when it comes to youth, young adults, people with maybe mental health concerns, I feel that we have a moral obligation to really make sure that we know what they need and want, and that we're advocating for them with people that may not necessarily be aware of the science or the research behind why some policies can help and why some policies can actually hurt.
Yeah, absolutely. Well, I just wanted to add that the Partnership for Public Health is in the Laconia area, and you cover that region. And I have just always found that amazing advocacy happens in that community, and it's just so great to see the change. So we're so happy that you are being recognized, but not only you, your whole community. So Kimberly, thank you so much for this, and congratulations.
Thank you so much. It's truly an honor, and knowing that I'm getting it from somebody who did such wonderful work and unfortunately has passed. It makes it that much more meaningful to know that it's in her honor, and I'm carrying on the work that maybe she would have been able to do.
Yeah, it's a very special award for a very special person, and we are very happy another special person is getting the award.
Thank you.
Thanks, Kimberly.
I know it's already been said, but congratulations again, Kim. It was a treat to listen in on your conversation with Kate and to hear a little bit more about all that you're doing. You're truly a rock star and a tireless advocate. We appreciate you. I'd now like to also shift gears a little bit and recognize another incredible advocate for our next award, which is our Tom Fox Award for Excellence. This year it's being presented by New Futures Communications Director, Bobby Burgess.
Hi there, I'm Bobby Burgess and I'm the Communications Director here at New Futures. And today I am pleased to present the Tom Fox Award for Excellence to my friend, Dr. Albie Budnitz. Formerly, Dr. Budnitz practiced internal and pulmonary medicine in Nashua and was the president of the New Hampshire Medical Society. Currently, he is Breathe New Hampshire board member and a health advocate. Albie's life work has been devoted to informing his patients and the public about the harms of tobacco products and help to lead public policy change. New Futures has been fortunate enough to work with Albie and other tobacco prevention advocates on the successful Tobacco 21 campaign, funding for the New Hampshire Tobacco Prevention and Cessation Program, and much more. He's always ready to testify, pen an op-ed, serve on a panel, or perform any advocacy ask we ask of him. So I would like to ask you about what the overlap is between the medical field and your advocacy.
Well, thank you. First, I want to thank you and New Futures. I'm honored to be the recipient of this award, but I must say none of what has been done could have been done without super dedicated individuals and agencies. It's always been and will always continue to be a team sport and a team effort. We have a long way to go. Advocacy work and resultant policy change is really a key component of what's called the behavior change cascade, or so-called cascade of change. The sequential components are to change knowledge through education, change the environment through policy and advocacy, that's where that comes in, and then finally to change norms through a comprehensive community program, which includes many policies and many facets. Cigarette smoking is a perfect example of this. Literally millions of lives and health care costs have been saved in the last 50 years since the first Surgeon General's report. The 50th anniversary was in 2014 and documented all this. In relation to the impact on the public and population's health, I feel that this effort and vaccines were the top medical advances of the 20th century, more so than any technical advances, at least in the way of saving people's lives and the public health.
Like you, Tom Fox was a fearless advocate for alcohol and other drug prevention for over a decade, and you have 42 years of advocacy under your belt. I'm wondering if you could talk a little bit about your, the public policy when you're most proud of, and what you hope to see in the prevention space moving forward.
Well, for me, the biggest advocacy win over the years was the indoor clean air legislation that was finally signed into law in 2007 that made restaurants smoke-free. Eating out is so much more enjoyable, and I really love to do it. Data has long shown that there is no risk-free level of secondhand smoke. There's an entire Surgeon General's report on that in 2006. And as far as going forward, I think 80% of what makes up our being healthy or not is the upstream social determinants of health. The behavior change cascade is a way, if not the way, to make that difference. And advocacy policy change is an integral component of that.
So in the future, what do you hope to see in this prevention advocacy space?
Well, first I'd like to thank some folks. This is a team sport, and I certainly have not been alone in this, and otherwise nothing would have gotten done. And although nowhere near a complete list, I do want to recognize and thank individuals and agencies that have had a major impact on me in this effort. Chronologically, these include Dr. Jim Squires and Matthew Thornton Health Plan, CEO Dan Fortin, and the program directors Joan Stevens, then Diane Smoger, and in the last many years, Alyssa Thompson at Breathe New Hampshire, formerly ALA of New Hampshire, among other names it's had in the last 105-year history. Jan Valuch is health educator in Nashua School System and co-founder of the Nashua Tobacco Free Youth and now the National Prevention Coalition. Palmer Jones is a retired executive vice president of the New Hampshire Medical Society. And finally, the late Dr. C. Everett Koop and the Koop Institute and the Norris Cotton Cancer Center at Dartmouth. As far as the future, the hope would be to regain trust, likely through education and communication, to enable collaboration for the public good. For the public good, for a free, safe society, and for everyone's existence, for really Earth's very existence.
Well, thank you for your advocacy, Albie. For a healthier New Hampshire, you've done so much. You've contributed so much to your advocacy, and we at New Futures. Greatly look forward to continuing to work with you on, in policy and advocacy.
Well, thank you very much. Much appreciated.
Congratulations, Albie. It's a well-deserved honor. Thank you for all of your continued work and dedication. It's always interesting to hear some of your history and background, and again, your continued dedication to addressing youth tobacco use in this state. We could not have a more valuable champion on our side on those issues. And now I'd like to shift gears for a moment, and we're going to get into our 2021 scholarship recipients. For this particular portion of our event, our scholarship recipients had an opportunity to sit down with some of our community engagement staff to discuss their work over the past year. And I have the pleasure of being able to share with you a bit of those conversations.
Hi, I'm Katie Parziali, Community Engagement Coordinator for New Futures, and I'm pleased to present the Kids Camp Scholarship recipient and my friend Kathy Livingston. Kathy is the Community Liaison at Children Unlimited, as well as the Interim Director of Family Connections Resource Center housed within Children Unlimited. As part of her work, she leads the Mount Washington Valley Early Childhood Coalition and has brought so many excellent partners from around Northern Carroll County together to help people stay connected and to share resources and information. Kathy embodies the New Futures mission to advocate, educate, and collaborate, and she's brought representation to an often underrepresented part of the state. Kathy, can you tell us a little bit about yourself?
Well, first and foremost, I just want to say thank you so much to New Futures staff and to the Board of Directors, because this is such an honor to be accepting this award, to be nominated, and to be accepting of the scholarship. So I thank you, and I thank your organization for all the wonderful things that you do to promote family voice, to elevate it, to provide trainings, and just your dynamic staff. I've had the pleasure of working with Katie. Both Katie and Rebecca Wachowski are on our Mount Washington Valley Early Childhood Coalition. Dynamic people to be a part of such a wonderful organization and really helping families in New Hampshire. So I thank this organization so much. I am excited, I'm honored, and I'm just very grateful to be here today. So I just wanted to say thank you. I do work for Children Unlimited, which is in the Mount Washington Valley. We're in Carroll County, so we're a big county, but we're very rural, and we have wonderful community partners that we work with. We're closely connected to Carroll County Public Health. We work with all the hospitals, the community health centers, mental health. We have so many organizations that really came together over this past 16 months to say, how can we help our community? What can we do? What needs to be done? And really within that, asking parents, what do you need? What is it that we can help you with? And encouraging them to be part of coalitions. We have a parent who's part of our leadership team, and to say, keep on going. You can be an advocate too, and you can be the best advocate for your family.
I think one of the most impressive parts about your coalition leadership has been that during the pandemic, while we've all gone virtual, so many coalitions have struggled to keep people coming to their meetings, but your coalition has grown and you have new people on it, and you've started a leadership team which includes parents. I just think it's wildly impressive and fabulous. Thank you, Kathy. What would you say to someone who's interested in becoming an advocate?
I would say that there is a place for everyone and that everyone is welcome. So it's not a one action that you have to do. It can really be sharing your voice and sharing your experience is such a powerful tool. So whether you're comfortable writing a letter to the editor, attending a legislative hearing, going to New Futures for a training, whatever it is that you need or would want to help you to elevate your voice. But the most important thing is that advocacy to me means hope, that there's a great hope for change, and that you can make that change by sharing your voices, sharing your experience, and sharing your stories, and that people will listen. A really important part of advocacy work is taking the time to listen to people, to form those relationships, to have that basic foundation. So if we are able to do that and encourage people to do that and say it's not scary, we've done it too, and that you really can make a change in New Hampshire. So I would encourage people to ask questions if they're unsure, but just to let everyone know that they do have the power to do it. It's very empowering and it's very uplifting, and it's just an incredible venue to be able to share your experience and share your stories, and to be able to talk about the things that are the most important to you as a caregiver, as a parent, whatever your role in a family is, and your importance to a child's life.
That was beautifully said. Kathy, thank you so much for everything that you do, all of your work for Carroll County, for the kids at the Family Resource Center, for the state as a whole. You're just phenomenal. Thank you.
Well, thank you so much. I appreciate it.
My name is Kim, and I'm a Community Engagement Coordinator here at New Futures, and I'm thrilled to present the Behavioral Health Scholarship to Kelly Torgy. Kelly is a home visitor at the River Center Family Resource Center in Peterborough, New Hampshire. And Kelly's been a longtime advocate for those that are clients of her home visiting and people within her community. And I'd like to know, what are the challenges that the COVID-19 pandemic has brought to the Family Resource Center?
Oh, hi. Well, thank you. Welcome. A lot. We have really had to re-look at the way we're doing things. Being a home visitor used to mean that I was going into people's homes and sitting on their couches and playing games and, talking about child development. And now it's a lot over the computer. And that was a challenge. It was a challenge. We had a lot of volunteers, an older community that folks, and they didn't feel comfortable. We've done some outside programming, and we are excited to recently announce that we have some new space in our office. We have widened our conference room and made that bigger so people can spread out, and we've done outside programming. So it has been difficult, but we have learned a lot and met with people outside, places we've never been, and made new programmings.
Yeah, you could definitely say that you guys have been very resourceful in this time as well.
Yes.
Perhaps.
Yeah. It was a learning curve, but we're here.
Amazing. And what has prompted you for advocacy on behalf of parents with behavioral health challenges?
Mental health is such a hard resource to find. There are so many people looking for that in so little beds or so little therapists, and we're all out there doing our best to serve these folks. And we have a lot of women who, more than not, suffer some from postpartum depression. And so, making sure those resources are there and will continue to be there for our families is so important. That got me involved.
Absolutely. Well, thank you so much, Kelly. It's a great pleasure to award you our Behavioral Health Scholarship, and thank you so much.
Hello, my name is Deli Champagne, and I'm a Community Engagement Coordinator for New Futures. My job allows me to work with advocates on a number of health-related issues, and I've been fortunate enough to work with some pretty incredible people who are willing to share their stories to bring about change to New Hampshire laws. Grant Olin is one of those folks. Grant, we met last year, and you shared your lived experience with me. You didn't even really know me, but you were so willing to be open. Tell me about your story and why you became such a strong advocate.
Well, thank you for having me here, Deli. So I struggled from the age of 16 with substance abuse disorder, pretty much anything I could get my hands on. And that went on for 25 years, went to losing license, to end up being estranged on the streets of Concord, hadn't seen my daughter in years. Just heartbreaking, and telling myself that the more I used, the guiltier I felt, and it was just the snowball that carried into my addiction. So I share my story with anybody I can to let them know that there is hope. I was in such a dark part. I'd given up on any chance of sobriety for myself, because I had tried so many pathways and so many different jails, institutions, and everything else, and nothing seemed to work. So I just gave up and continued on my path, which I was on. So at one point, I was able to get into a long-term treatment facility and got sober, and it absolutely changed my life, restored all the relationships in my family, and I was able to use that story to help people, and it seemed that people received it and gave them a little bit of hope and strength. So I try to do that everywhere that I can get the opportunity.
And are you doing that in your professional life as well?
So after graduating the long-term treatment facility in Manchester, they hired me on to do intake, so I learned some skills as far as computer skills and so forth, which was great. Worked there for about 4.5 years doing intake. Also got married in that time, also got all the relationships restored. It's been amazing journey in the 6.5 years. Recently, I've been hired on for Recovery Capital RCO here in Concord, which is a great opportunity for me to come back into the community that helped me out so much when I was struggling and kind of try to give back some of that. And I'm super excited to do that.
So you're proof to me that the programs we support in New Hampshire actually work.
Absolutely. Absolutely. Like myself, unfortunately, a lot of us don't get it the first time. I was so stubborn. I was going to do it my way, and that wasn't ever going to work. I had no surrender in me whatsoever. But unfortunately, that stubbornness comes in handy now when I'm able to go out and kind of advocate for people.
I love the fact that when I reached out to you and you shared your story with me, you had no hesitation to share it with our 424 lawmakers. Not only did you send them an email, but you offered to call them directly. And to me, that is, I think, an example of what kind of a heart you have as a human being. You know the power of the personal story, and that if we want to effectuate change in New Hampshire, we need to share stories of people with lived experience. So that's why I nominated you for this award. A lot of people would not be willing to share their story. There's so much shame and stigma attached to it. But I think you're going to change lives. I think you're going to keep people alive with your story. So that's why you deserve this award. So I'm so grateful that you exist and that you've done some great work with us here at New Futures. And we are going to certainly use you in the future, because you have such a strong and powerful voice, and we appreciate that, Grant. Thank you so much.
Well, thank you. It's such a blessing to be able to do that.
Thank you again, and congratulations to all of tonight's advocates, partners, and policymakers that we had the opportunity to honor. It's now my duty to remind you yet again that while we've reached the conclusion of tonight's event, there is a lot more work ahead of us. And there are also plenty of opportunities to engage and support change efforts in the coming year. Whether that be attending a free advocacy training, such as one that we have coming up on early childhood policy on September 27th, following opportunities to weigh in on a hearing, you could testify or again engage in some of that administrative advocacy that we mentioned earlier, host a Zoom meeting with an elected official, or reach out to learn more about one of our partner field grant opportunities. We hope each of you will continue to collaborate with each other and raise your voice over the coming year. On behalf of the entire staff of New Futures, we look forward to working with you, and we are dedicating ourselves to continuing the fight to ensure that every single Granite Stater has the opportunity to start healthy and stay healthy. Thank you again for joining us tonight, and we hope you have a great evening. And I also am looking forward to seeing who has won some of our raffle prizes. Best of luck to everyone.
I had the pleasure of knowing Phil for several years. Phil was part of a team that we put together to open up Navigator Recovery in Lakes Region. Him and I had a lot of great conversations. I learned a lot from him about recovery, about persevering, about making every day like it was your last. And he's going to be missed. He's going to be missed greatly.
Hey everybody, it's Dan Feltis. I had the honor and privilege of knowing Phil, working with him, on so many issues, including Medicaid expansion, reimbursement rates. I can tell you there's no words that can fully capture the force that was Phil, both in terms of his advocacy but also his work on the ground, helping people who needed it most at the time that they needed it most, including many times out of pocket, providing sober living and recovery housing. His example is an example to all of us. Speak truth to power, don't give up, keep up the fight.
Phil Spagnuolo is a different kind of representative. Though there are other lawmakers in recovery, Phil is one of the only ones I know that based his public service almost entirely around his experience with addiction. He became a legislator to be a champion for individuals with substance use disorder, and in doing so, he changed the way the State House operates. Phil championed numerous bills and initiatives to increase support and resources for individuals and families impacted by addiction. Some of his bills became law, others didn't, but Phil's impact goes far beyond legislation. By speaking so openly and honestly at the State House about his own experiences, Phil not only reduced stigma and increased awareness and empathy among his fellow representatives, but he set an example for others from different backgrounds to follow to run for office, share their stories, and serve their state with honor, courage, and grace.
As a Belknap County Commissioner, I had the good fortune of getting to know and working with Phil Spagnuolo. First, his Navigating Recovery group was a huge help to those in recovery coming out of the CORE program at our county community corrections center. Later, as a state representative, Phil was a strong supporter of our programs in the community corrections center. We will all miss him mightily, but his legacy will continue to be a strong.
Phil was a person who seemed to have mastered one of life's great secrets, which is that if you feel like you belong somewhere, it is not very hard to give that feeling to everyone else you encounter. He was someone who always made me feel like my time and my work were worthwhile and important, and every time he walked into a room, I felt like I was getting a huge hug. His advocacy strategy was pretty straightforward. Love people until they understand, and keep on loving them even when they don't. He changed a lot of minds that way, and he changed even more hearts. And I know he saved a lot of lives.